Are you looking to decide whether you want in-home care or community setting for your loved one? These are the main differences, in my opinion, and how to know which option might be best for you. The first is going to be staffing. There is nowhere you're going to find one-on-one staffing except for in-home care. Communities like assisted livings, nursing homes, skilled nursing, independent living, memory care. At best, you might find a 1-to-4 ratio or a 1-to-6 ratio. Very rarely are you going to find less than that, and you will not find a 1-to-1 ratio. I've even heard assisted livings with ratios as high as 1-to-18. You just have to ask which facility you're looking at. It could be higher, it could be lower. But if you're looking for a one-on-one care provider, you're only going to get that in in-home care. The next difference is going to be the comfortability and familiarity of home versus a new environment. I always compare this to when you go on vacation. You can have the nicest hotel with the greatest amenities, but when you get home, you're happy to be home and sleeping in your own bed. That is an unbeatable aspect of living at home that a lot of us don't want to give up. And if you can afford the help at home and you're safe at home, that's going to be an option that a lot of seniors would choose. Which brings me to the next difference, which is going to be cost. In general, you're going to spend more money in assisted living or skilled nursing versus in-home care up to a certain amount of hours. Once you hit over 40 hours a week, you're probably spending more on in-home care than you would in a community. You do have to compare those costs. With in-home care, that's just the cost of the care provider or the caregiver. That doesn't include the rent or the mortgage. That doesn't include the cost of food. It doesn't include medications. When you're in a community like an assisted living or a skilled nursing, when you're looking at your total rate or your total amount you're billing each month, they're going to have rent, they're going to have meals, they're going to have, housekeeping or laundry services, whatever added amenities you have, those are included in that rate. So when you're comparing costs, you want to make sure to calculate if this cost is what is going to include basically rent. So when you're looking at your house or in-home care, you would say, okay, well, if the house is paid off and I'm not paying a mortgage, I'm not paying rent, then there's that difference there. Now, if they're living in an apartment and they're paying rent, then you want to include that rent cost with the in-home care cost to evaluate if it's more affordable to be in-home or in a community. The next one is really evident now, and it was huge during the start of the COVID pandemic in 2020, 2021. Your infection risk is much lower at home than it is in a community. That's pretty obvious, but everything from cold, flu, COVID, norovirus, all of those things tend to pass around very quickly in communities. Even communities that have the best infection control, it's bound to pass. When you have that many people living in a close environment, people are going to get sick. So anyone with a lower immune system or, people who just don't want to get sick as often, being at home, you're less likely to get sick, especially if you have a consistent care provider. You have one person coming into your home that you're interacting with that day versus, upwards of 15 to 20 people you could see in a community. The next is maintaining independence for longer can be done at home than it can be done in a community. The reason being, as care providers, caregivers, despite our best intentions, in a community, you're on a strict schedule. Even the communities that tell you you're not on a schedule, you are, unless they have 24/7 meal plans. If they have 24/7 meal plans and you can get food whenever you want it, and you can get help in the bathroom absolutely anytime you want it, and you can get a bath anytime you want it, unless those three things are guaranteed for you, you're on their schedule to some extent. So if you want that independence to get up when you want, and eat when you want, and get yourself dressed without feeling rushed, because I can tell you from my years as a CNA, it's really hard not to feel like you're rushing a client when you have to have them up, dressed, teeth brushed, hearing aids in, looking presentable, and down to breakfast on time when you have 10, 15 clients you have to all get down to breakfast at the same time. That's really hard to give everyone the flexibility to take their time when you're handling that big of a patient load. When you have a one-on-one client, you can take their time. They can listen to music. They can take a long shower. They can change their outfit multiple times. They can have their coffee and read their newspaper before breakfast. They can do all of those things and really have that independence and the choices that they might not get in a community. Even the best communities are going to they're going to struggle to provide that, because at the end of the day, it doesn't matter how much money you're paying, caregivers and CNAs are still having to face the overwhelming task of taking care of more than one client at a time. Even the best CNAs, that can be a challenge. And usually the way that we cope as caregivers is we have a very strict schedule. We get very efficient with what we're doing. We cut out things that are not essential, like chit chat, companionship, painting their nails, taking their time to do their makeup, taking their time to make their hair look nice. A lot of CNAs still do that, but you're going to struggle to do that when you're getting 15 people up versus one-on-one. If any of these things you think, okay, well, I think I don't care so much about choices, or I don't care so much about routine, I'm fine with going whatever the community routine is, then that might be a good choice for you. But outside of your preferences, you're also going to have to look at need. Now, if you are someone who needs a high medication regimen, let's say you're a diabetic who you're not able to manage your own insulin, or you have very inconsistent blood sugars, or you're on a blood thinner and you're a fall risk, or you are on oxygen that needs to be changed a lot, or you have wounds that need to be dressed every day or dressed frequently, those are all reasons that you might want to consider a higher level of care, like a skilled nursing. A skilled nursing is going to have a nurse on staff 24/7, at least one for that unit. And an assisted living will usually have a nurse on call. Now, they're not always going to be there in general, but they'll have one on call. In-home care does not have nursing. I am a nurse, but in general, in-home care does not have nursing because it's a non-medical service. So we provide the physical cares. We can help with medication reminders, but we're not doing complex medical things like wound cares, wound dressings, sliding scale insulin, those kind of things. So if any of those factors are applicable to you or your loved one, you might want to consider skilled nursing or assisted living versus in-home care. Now, I will repeat what I said earlier. If you are looking for more than 40 hours a week, the name of the game is really affordability, really your financial situation. If you can afford 24-hour care, or you can afford more than 40 hours a week, even if it's less cost effective than a community, and all of those options I talked about in the beginning, all of those differences, you prefer the in-home option, of course, then in-home care is the right option for you. And for a lot of my clients, that's the situation they are in. They can afford the help, they want to stay home, and they're happy at home. Then in-home care is going to be a great option. But if you cannot afford more than 40 hours a week care, and you need more than 40 hours a week care, and finances are going to be an issue, you might be forced to make a decision about a community, even if it's not the decision that you would want to make. Lastly, you also want to keep in mind that Medicaid waiver is an option for those who are on Medicaid who want to go into an assisted living or in-home care. You can use it on those two options, but you can't use you can't use it for both things. So if you live in an assisted living that Medicaid waiver is paying for, you cannot have caregivers through in-home care come in and take care of you. So if you're needing that additional help, you're likely going to be moved to a community like skilled nursing facility with a higher level of care. This is just a very basic outline of the differences. There's a lot more differences, and it just depends on the community you go to. I used to work in skilled nursing, but it's been a while, so there are some things that may have changed since my most recent experiences. So please don't take this as an insult if your community is not like this, because there are some amazing communities, but I would still bet you're not getting one-on-one care with a community. I just highly doubt it, even if you say you are. Call times alone, I know, would not make that possible. But anyway, if you are looking for an in-home care, or if you're looking for placement in a community, please reach out. We have so many resources in our community that can help, and you don't have to make those decisions alone. Thank you for watching, and please stay tuned for more videos at truenorthhomecare.com. Check us out on YouTube or on Facebook.